Well, a warm welcome to this video and a particular welcome back to Professor David Anderson. Professor, thank you for coming back.
Thank you very much, John. A pleasure.
Now, you've done a lot of the pioneering work on vitamin D in your career as a professor of endocrinology and a consultant physician and a lifelong medical author and communicator and teacher. And we've been reading your book here, the Vitamin D and the Great Biology Reset, that you co-authored with Dr. Grimes, of course. Now, just to give a bit of background for people that didn't see the previous video, can we just think about vitamin D and the, well, what really can be described as a pandemic of vitamin D deficiency?
Yes. Well, vitamin D, I mean, I've just worked on vitamin D sort of intermittently throughout my career, which goes back to, and the first time I came in contact with the vitamin D was back in the 60s, when I worked on a kidney unit in Dundee shortly after qualification, and they had cases of vitamin D deficient rickets there. And the group that I was with, Bill Stewart and Professor Ken Lowe, they had a family of vitamin D deficient rickets, and we when I later, I mean, I sort of specialized for 3 years in renal disease, and then it was felt that I was specializing too early, so I was fortunate to be appointed to a job at the Hammersmith Hospital. And at the Hammersmith Hospital, you were expected to do research. I mean, these were really in the days where the research was done, you know, on the hoof. And I tried to set up an assay for vitamin D for 25-hydroxy. This was right at the time when the workers in the States and elsewhere were working out what the mechanism of action of vitamin D was. And it was, the first thing was 25-hydroxy was discovered. That is calcifidiol, and that is the reservoir form. Well, it was quite difficult. I was trying a type of assay called competitive protein binding, which was at the forefront in those days, and I found it too difficult. And I actually went on and worked on testosterone and sex hormone binding globulin, which is referred to, in the book I mention the mechanism of action of testosterone and other sex hormones. And it was only later then when I went to, I was appointed as senior lecturer, this was in 1975, I think, at Manchester Royal Infirmary, where Bill Stanbury had a big vitamin D unit, led by Barbara Moore, who was really excellent. She, alas, is no longer with us. And I had a research fellow. I mean, these were the days where you could apply to the Wellcome Trust for a travelling research fellow, and actually they could work on whatever you thought was good. Anyway, this Stavros Manologas wanted to work with me and wanted to work on osteoporosis. Anyway, eventually, quite soon, we did some lab work on, with the help of people at Sheffield, on the vitamin D receptor. And you'll find I sometimes say vitamin D and sometimes vitamin D. Anyway, same stuff. And the vitamin D receptor, it was known by then that the metabolism, the active form, was 1,25-dihydroxy D3. And that was when, so we were working with fetal rat skull bones. I mean, it's really primitive technology, but we got the binding method working and found evidence of high affinity receptors and put them in culture. And we were the first people to show that actually in culture, the D receptor in this bone system, the D receptor was dependent upon glucocorticoids, cortisol and dexamethasone and stuff like that. And they disappeared. We'd looked for receptors for cortisol and found them, and found when we cultured with cortisol and at physiological levels, the vitamin D receptor remained. So, you know, and Stavros went off to the United States eventually, and worked with people like Mark Hausler, I think, and has made a career out of it. Now, I once met Stavros recently. Well, it was 10 or 20 years ago, and he said, David, you could have been so great if you just stuck at one thing. And I've never done that. I've moved in where, as a clinician, I did quite a lot of research on Paget's disease of bone, and I've had have that sort of mind that wanders around and picks up ideas and picks holes, and that is not the American way. It's not the American way. I was offered a job in California at the Scripps Institute. It would involve changing a research tack. And I went to stay, Jenny and I went to Hawaii for a week. And we stayed with somebody called Fred Greenwood, who was a British endocrinologist. And I asked him, I said, should I take this job, Fred? And he said, the thing you need to remember, David, is that the advantages of living in the States and working in the States are very obvious, and the disadvantages are much less obvious. Whereas with Britain and Europe, it's the other way round. And I came back to Bath, and got this job in Manchester.
Interesting. So you were one of the first people to realise that the vitamin D had a specific receptor. So we have a particular type of vitamin D molecule, and that fits into a receptor which is specifically designed for the vitamin D. I mean, is this receptor sitting on cell surfaces?
No, it's not a cell surface receptor. It has a intracellular binding protein, which is very, very interesting. This is touched on in the book, one of the things I learned a lot writing this book, because I'd kind of left research. I'm 83, and I thought I was retired. And at the beginning of the pandemic, of course, I realized, as did David Grimes, who I've got to know as a result of this, and is a good friend, I realized that this was two pandemics. It is a pandemic of D deficiency and a pandemic of this virus. And I've been working with Giuseppe Trita, who's become another good friend, and he's a real expert. He wrote a very good book in Italian on SARS-CoV-2, the virus. And the evidence that this was a man-made virus is absolutely phenomenal. So Joseph and I, in the summer of 22, we submitted, with the aid of a lawyer, we submitted the case against 10 people we assess were involved in different ways in creating this virus. 5 of them are Americans. There's a Brit, there's a Frenchman, there's an Ethiopian, and somebody else. Anyway, so I've kind of it's very interesting. Turning back to the question of attitudes to research, because I went to another hospital, Hope Hospital in Manchester, and then when I was 50, I got a job offer. I heard about a job in Hong Kong, and that was professor of medicine. Well, I'd got a personal chair in Manchester, but I decided that I'd go for this because I was really interested in improving medical teaching. And so I was appointed. I mean, they clearly realized fairly soon that I was the wrong person for the job because I was too argumentative. I was But that took us to Hong Kong, and I was professor of medicine there for 3 years. And then I'd been making medical teaching films because I thought that one of the big problems with medical teaching was it was specialists teaching students and not learning what other specialists were doing. So, you know, I then went into private practice and continued to make the medical teaching films.
I think it's really useful to be able to document the history of talking to people like yourself, documenting the history of this research is really useful, the way that ideas developed. We want to talk more about your ideas in Hong Kong, but just before we go on to that, you identified basically that there's a vitamin D pandemic. Would this be difficult to treat? Would this involve sophisticated high-tech treatments to make the world population vitamin D replete?
No, the thing is that it would be incredibly cheap. It would lead to the destruction of Big Pharma, because much of what Big Pharma depends on, and I discuss this in the book, a lot of diseases, there's hardly a disease that you can name that isn't made worse by D deficiency and improved by D repletion. And it would cost the square root of bugger all. I mean, it costs nothing. It's about 5 or 10 or 15 euros or pounds per year per person, and less for a kid. You know, it's absolutely ridiculous. I calculated to make the whole world D-replete would cost about 20 to 30 billion dollars. Well, since there are 7 billion people or 8 billion people in the world, it's falling now thanks to the pandemic. But you know, it would cost next to nothing when you look at the profits. Bill Gates is proud that he made $190 billion from his investments in Moderna and Pfizer, his investments in a patented compound based on a synthetic virus. I mean, it's mind-boggling. But so there's an enormous amount of silent resistance. I mean, silent. Nobody dares say attack vitamin D. They say, well, you've got to be very careful, not to overdose. So, you know, NICE, which is one of the nasty bureaucratic organizations in Britain, NICE identifies 400 units per day of vitamin D. Well, 1 unit is enough to stop a fetal mouse getting rickets. You know, it's peanuts.
But I don't see a lot of rickets. I don't see a lot of rickets in the UK, David. I mean, you know, if you go to India or into history textbooks or other poor parts of the world, you will see children with bendy bones, and that persists into adulthood. But I don't see that in the UK. So
no,
surely we're getting enough vitamin D.
Well, the problem is that if you go back to the mechanism of action of vitamin D, it evolved as an essential part of our defense against diseases. I think that because the immune system, every aspect of the immune system, is vitamin D dependent. That is to say, it depends on 125. And then our predecessors, you know, bony fish developed from the lamprey. I think that's you know, maybe 400 to 500 million years ago. And prior to that, vitamin D subsequently was then taken over, or nature's very economical. So this wonderful, marvelous substance that's only made under the action of ultraviolet light on your skin, essentially. Fish get it. You get it from fish, but that's because fish eat plankton. And in plankton, it actually, as David Grimes said, it protects the plankton against ultraviolet light. So this this compound is one of the miracles of life on Earth, vitamin D.
So vitamin D in the algae is doing much the same thing as melanin in us. It's protecting them from ultraviolet light. But then the fish eat it, and we can eat the fish, and light. It's essential for. I mean, am I right in thinking 2,000 or 3,000 genes depend on vitamin D for their activation?
Well, certainly 1,000, and probably 1,000 and counting. 3% of our genome, it's estimated, but when you count all of the supplementary factors, genes and things, I've no idea how many. But one of the things I wanted to just mention about vitamin D, because quite a lot of people often ask me, well, should you take it with K2? And this is something that's got into the sort of unofficial literature. K2 actually you can make, I mean, if you've got good enterobiome, I think. But in any case, the problem with vitamin D is vitamin D actually acts through a vitamin D receptor, which acts in concert with a vitamin A receptor. This is how they switch on. It switches on the genes. Doesn't act. The VDR doesn't act on its own. It's got to have its ligand, and it's got to have RXR, retinol receptor, with its ligand. So you definitely need vitamin A as well as D. But you can get A from all sorts of foods. So vitamin A deficiency, in certain parts of the world is important. And the vitamin A, but another element which I discovered reading up on the literature, working for this book, is that the question of the non-genomic responses, vitamin D also binds, when I say vitamin D, I mean 125 dihydroxy. It also binds to the same receptor at a different binding site. And on that binded site, it acts on its own. And this is this causes rapid responses, one of which is acting on things called caveoli, which I understand has something to do, excuse me, with stopping viruses getting into your cells. So vitamin D is absolutely a miraculous supplement.
So the way I think about this, David, is there are vitamin D receptors on probably all cells in the body, but certainly vitamin D receptors on all of the white blood cells involved in immunity, on the lymphocytes, on the monocytes, on the whatever, all of the white blood cells, the neutrophils, the macrophages, the lymphocytes that produce the killer cells. The
lymphocytes are interesting because they are under control of dendritic cells, which have the 1-alpha hydroxylase that makes 125, provided you've got a big enough reserve of calcifidiol. You've got to have a good reserve. And they act on other cells, which are the lymphocytes. So the lymphocytes have the receptor, but that's a local effect. And I mentioned, I didn't really get into the question, but evolution of the hormonal effect. I mean, a classical hormone is obviously, as you know, it's produced at one site in the body and travels in the bloodstream to act at other sites. I mean, it's diffused and it's picked up by receptors. And in the case of vitamin D, it promotes calcium absorption and calcium resorption from the bone. So, and that is under the control of the parathyroid glands. So the parathyroid glands monitor the ionized calcium in the blood, secrete their hormone, PTH, which then travels and finds these cells, it acts on the cells in the renal tubule, controls calcium and phosphate transport by mechanisms which are now very well understood. And the problem is that NICE, who I was rude about slightly earlier, NICE believe that this is the most important function. But in fact, it's the greediest function. So because of the production in the kidney, it's really important for you as an organism to have a normal ionized calcium all the time. So, for the fight and flight reaction and the function of your nerve cells, that is vital. So you can forget about the immune system for a short while, but then it's really important to know what your vitamin D level is. I did a little Zoom chat the other day with a congregation in a church, and nobody in the congregation knew what their vitamin D level was. Now this is, had even had it checked and had a doctor say, you've got enough or you need more.
And of course, the reason you were doing this is that this population was at particular risk of vitamin D deficiency, because we were dealing with a largely dark-skinned population in a northern region. Yes. Their risk is extreme. Yes,
and back to you asked about rickets in Britain. Rickets obviously was very common in the days of the Industrial Revolution, where there was pollution, children were working, never getting out in the sun. So rickets and osteomalacia, which is the adult version of rickets, were very common. Interestingly, when I was working in Dundee, there was a lot of rickets and osteomalacia among Asian immigrants in Scotland. No surprise there at all.
So it's rather strange, David, really. We have this National Institute of Clinical Excellence, which must be good because it's got excellent in the title. And they have this really simplistic idea that vitamin D is for calcium, and that's pretty well all. Whereas we know that that is the one that sort of takes precedent over the vitamin D. And if there's, because that's an emergency, if your calcium goes up or down, that's clearly a life-threatening condition. But we now know it's essential for all of the functioning of the immune cells, and they don't seem to realise that.
And a tremendous amount of other organs. I mean, the brain. There's a epidemic of Parkinsonism, for example. The cells that are in your basal ganglia depend upon adequate amounts of the precursor of calcifidiol, 25-hydroxy. And the problem is that many of these tissues, if you get severe D deficiency, and especially if you've got some sort of slow virus infection, which once the cells are lost, they're lost forever. Now, we've got a good friend of our youngest son who developed Parkinsonism, and I got him to get onto this, it was a number of years ago, onto vitamin D, and it hasn't progressed. But it hasn't regressed either. What we're finding now, and there's something else that I think needs emphasizing. David Grimes on his talk illustrated this, that one of the effects, once you use vitamin D by this mechanism to switch on needed genes, one of the genes it switches on is 24-hydroxylase. That converts 125 to 124-25, which is more water soluble, but is also inactive. It's not believed to have any significant action. So it's built in to the system. The more you force by vaccinations, pseudo-vaccinations, infections, etc., the more you force your immune system to fight, the more it will consume vitamin D. And what we're seeing now, it's absolutely outrageous. As Professor Dalgleish eloquently illustrated. I mean, he's an expert on the cancers. There's a pandemic of all sorts of cancers. And it's absolutely outrageous what is being done by under the name of the World Health Organization, the World Kill Organization.
Hopeless.
Would be a better
Hopeless.
name.
But the key physiology here is that any molecule of vitamin D that is in our blood can only be used once.
Absolutely.
Then it has to be replaced by a fresh one.
Yes.
So we need a constant topped-up reservoir, this calcifidiol reservoir form.
And this does make sense because obviously as we evolved out, in the sunshine of Africa. We know, for example, that the Maasai young men, almost naked, possibly completely naked, they naturally produce vitamin D levels in the blood around 60 nanograms per mil, 60 to 100 nanograms per mil, which is the sort of level everybody should be going for. But the only way most of us can do that is by taking supplements. And you don't need to...
100 nanograms per mil would be 250 nanomoles per litre.
That's right. Yeah, and I try to run mine up, but in the high, last time I checked it was 84. And it's been up over 100. Because I take one capsule, which you can get in Italy, of 100,000 units once a month. And once or twice a month, I will, if I get any sort of infection or something, I will take one capsule of calcifidiol. But I mean, we're talking about peanuts, and we are talking about a very, very serious threat to Big Pharma, seen by Big Pharma, because, you can't buy calcifidiol. You can't, and the brainwashing of the medical profession, I'm afraid, has been very considerable.
So I've got a question, David. When I retired from academia, I went to work as a part-time junior staff nurse again in A&E, in the local ED, which was great. I was looking after patients again and putting up drips and putting on bandages and not doing emails. It was a great time. But we had something called the sepsis 6. So when someone comes in with sepsis, we give them oxygen, we do the blood cultures, we give IV antibiotics, we give them fluids, we check their serum lactate and hemoglobin, and if necessary, we catheterize them, those 6 things. But most of those people that are coming in will be severely deficient in vitamin D.
Yes.
Now, I don't think there's any point giving them vitamin D3 because that's going to take some time to activate into the calcifidiol form. Surely we should have the sepsis 7.
Yes,
it wouldn't rhyme as well, but we could give them a whacking dose of calcifidiol and we'd be left with a protocol that didn't rhyme as well, but would save more people's lives.
Well, the sepsis 7 to prevent going to heaven. Good work. That's a...
Did you just do that off the cuff? That's really good.
That's a really bad poem. Anyway,
I'm going to use that, or wherever you go. Indeed, but so surely, if we gave calcifidiol, how long would it take for the calcifidiol? This is the activated form that you can get in tablets in Italy, but we're not allowed in the UK. How long would it take for that to become physiologically active and to optimise the function of the white blood cells?
Well, it's almost immediate because calcifidiol has one more hydroxyl group than vitamin D3 itself. It is absorbed from your mouth. I mean, I sent calcifidiol to Safdarjung Hospital in May of 2021. I did a little study with Professor Jugal Kishore there, and we've got a little film showing him giving people in ICU calcifidiol, just sticking a needle not into the patient, into the capsule, squeezing it into the mouth, and none of the people admitted to intensive care died. They all got out very quickly. Very quickly. So that is, yes, of course, we need a calcifidiol and some of the other things.
Because there's sepsis 6 protocol, the oxygen's going to keep you alive. I mean, that's great. The blood cultures are essential to identify the type of bacteria or indeed virus that's causing the sepsis, mostly bacteria. IV antibiotics, of course, are completely life-saving in the acute situation, as is fluid resuscitation. Checking lactate and hemoglobin is important, and catheterization is essential for monitoring renal function. But there's nothing there, nothing, that optimizes immune function. Why on earth would you not want to optimize immune function in someone with an acute infection? It's just bemusing. So post-viral syndrome. So I was talking to someone recently, and I've done this many times, who had one viral infection followed by another viral infection, probably COVID followed by an influenza or something. And she was like really debilitated after this. So she got over the acute infection, the fever went, but her limbs were heavy. She was tired. She had low mood. She just felt really terrible. And I said, look, go to the doctor. She went to the doctors, and they did eventually do a vitamin D test to see if this would explain what she was feeling after 2 viral infections. And it turned out her vitamin D level was 20 nanomoles per litre, which is 8 nanograms per mil. So, and it makes perfect sense in what you've said. So she had one infection and that used up her vitamin D. Then she had another infection and that used up more vitamin D. And then she after that, she'd used it all up. And of course, it's winter time here in the north of England. You don't produce essentially none.
Well, a level of 8 nanograms per mil or 20 nanomoles per litre. I have recently done blood vitamin D levels on a total of 105 people, many of them, including Novak, about 50-50 Novaks and vaccinated. And that is lower than any level that we've seen. And half of them are insufficient or deficient. So everybody should be taking vitamin D. And, and there's not really an excuse in Britain for not knowing what your vitamin D level is. Because, by the way, when I was over there, let me see if I can find my prop. If you go into Boots or a chemist, you can find vitamin D kits like that, which allow you to measure. It costs about £8. Vitamin D, another one, rapid test kit. It doesn't give you an absolutely. It doesn't give you. It just says insufficient, sufficient, very good, and too much. But it's still. That I strongly encourage, and I don't have shares in Boots or shares in anybody, but I mean,
if GPs around the country did this would be very cost effective because we could save a fortune on other treatments.
Of course, and
heart
basically,
disease, colon cancer, diabetes type 1, autoimmune disease. The list is long.
The list is indeed long.
Yeah. So before I rudely interrupted you and got you onto this digression, David, you were telling us about Hong Kong, because this ties in with a particular interest of mine. I think the reason that people developed dark skins initially, long time ago, was because if you've got light-coloured skin and you're exposed to African sunshine, that will break up your folic acid. You'll get folate photo destruction. So it's then an evolutionary advantage, a selective advantage to develop dark skin. So our ancestors would be very dark-skinned.
I didn't know about Foley, but also, certainly, undoubtedly, sunburn is not a good thing,
Yeah.
you know. But I mean, I've all sorts of reasons. We evolved in this absolutely unique planet with an extraordinary, totally unique distribution of land masses down in Africa.
Yeah, the Earth is indeed a very unique and special place, and it's probably the topic of another video, but my personal belief is that we are the only advanced life in the cosmos because of all the requirements, yes, that have to be just right to generate life.
Yeah, and when I was in sort of winding my profession down in private practice, which was also very interesting. I went into private practice with my wife, who was a GP, and so she knew lots of things that I didn't know, and vice versa. And but I have always been interested in art and in Chinese antiquities, and it was actually it was nearly 25 years ago that I discovered the Hongshan culture. And in fact, I've written a book. This is the book, Hongshan Jade Treasures, the art, iconography and authentication of carvings from China's finest Neolithic culture. Rather pretentious subtitle, but I wrote that book and I got it published locally here, actually, in Italy. Wonderful publishers. These are the publishers for the Catholic Church. And this is interesting and relevant because I found that it was obvious, and this is described in the book, if you got a microscope and looked at the pieces, looked at the art, and looked at most of these are little pieces, and because the dealers in Hong Kong know about it, they know that Western collectors don't want things polished to the eyeballs. I was able to study this, and it became, but it's totally denied. The Hongshan culture, I mean, the Chinese do know about it, and a lot of, there's the pig dragons and the icons that are common, but there's also a big faking industry, and it undercuts the business model of people because the things that were buried, and people were buried with their stuff. And this is an amazing culture, which then ultimately there was some sort of meteorite impact and production of a form of glass from an impact. There's an example of one piece that I've got. A rhinoceros. Now, I think I paid $20 for this on eBay. And what they're doing now, they're still mining this stuff. They're still quarrying it, but they're making things like this, silly glass balls, I mean, it's mind-boggling. So there's a denial of the obvious and denial of the past in China, which is sad. But it means, obviously, if you're collecting this stuff and you believe your own eyes, and it's been very interesting supplementary hobby.
But the reason this is relevant is that this glass would have been generated by a meteorite impact. Probably around about 12,000 years ago, that could have potentially, well, we know there's been bottlenecks for humanity in the past. That's why we're all so closely related. And that gives rise to the possibility, the fact that human beings are lucky to be here. We could have been,
We're very lucky. We're here in an incredibly narrow window of space-time. And what we've got now is we've got a psychopathic financial system that is run for people who are already very wealthy. And I'm afraid much of this does derive from another English-speaking country across the Pacific, or across the Atlantic, maybe. But it's very, very interesting. I'm very interested in the work of Graham Hancock and his collaborators, and there's evidence, overwhelming evidence, that there was a major disaster which nearly wiped out humanity 12,900 years ago, towards the end of the last ice age.
So, in a way, this meteorite impact of the past could have caused extinction of humanity, and we're seeing this as kind of an analogy for what could go wrong. I mean, people are so arrogant and complacent that they think we're going to be here forever, but actual extinction or near extinction of humanity is still a possibility.
Yes, well, after the Younger Dryas disaster, whether it was caused by what my argument is slightly different from, but essentially I'm in agreement that there was a meteorite impact. There was a massive explosion under the ice sheet, which caused the Carolina Bays, produced them and the Nebraska rainwater basins. Now, if you're hit, I mean, Antonio Zamora's calculated the size of these. I mean, some of the Carolina Bays were caused by a chunk of glass the size of the Yankee Stadium. I don't know how big that is, but that's in his book. So, it would not have been a good time. And this was the time when the Clovis people, the culture in the United States, what is now the United States, were wiped out in an instant, and all of the big mammals. And of course, afterwards, there were massive fires all over the United States, massive blockout of sunlight. And the arguments that there was a sophisticated, advanced culture that actually understood about the Earth, understood that we were part of space, and this culture, it's all denied by professionals, just as the work by Firestone showing and colleagues has been denied, and the book by Antonio Zamora is really worth getting. It's a really good book, and anybody, he argues he's a very, very good scientist, but not qualified to be talking about this any more than I'm qualified to be talking about meteoritic glass. It's just that the people who should be talking about it seem to have shut their brains off.
But the point is, this glass came from a meteorite impact, and that could have eliminated human beings as possible.
The glass is still being quarried in China. I've got absolutely, but I've been there several occasions back in starting in 2010. I think I know where the craters are, and I'm pretty sure I know where the glass is, and I suspect that these two events are linked. Submitted an article to Graham Hancock arguing for my case, which is slightly different from, but this is how science is supposed to work. People are supposed to start with a hypothesis and then refine it, and not declare, like certain people, I am the science. You remember, probably know who I'm talking about there.
There's a few candidates for that, but I can think of one or two, yes. No, I agree. It's all about it. These are interesting hypotheses that can be discussed. But I mean, the key thing to me is that there's been threats to humanity in the past, and will we be here in 100 years?
And we won't be here forever.
No. Oh,
and we should. Oppenheimer inventing the atom bomb. That was totally irresponsible. And the people who've invented these viruses that are working as bioweapons, sponsored by the Pentagon and DARPA, and absolutely outrageous what is happening. We should be concentrating on humanity and making life better for people, not wasting money giving people cancer because they've got D deficiency, and looking at the science behind previous extinctions and looking at the messages that were provided by people like Paul A. Violette, which this is a book that I've been reading, Genesis of the Cosmos. It's a very difficult book, but these are arguments that actually our predecessors, we just think we're the clever clogs, humanity, but there were very, very clever clogs people there for probably 15,000 years ago. And, the people who made the pyramids, come on, we should be concentrating on the positive things and not making biowars.
I think looking back at the past and potential near extinction events can warn us how to avoid future extinction events. I mean, do you think viral research, laboratory-based viral research, is a threat to human existence?
Yeah, well, Ebola and Zika. There's evidence that these are tailored viruses and released. This is the essence of the case that Joseph Tritter and I have put to the International Criminal Court, is that if you are working on a bioweapon, you should be held responsible for your actions. Sorry, this is the case. And, you can't hide behind the fact that you're receiving lots of money from the Pentagon and you're being told by your supervisor to do it. That didn't work. That wasn't supposed to work at Nuremberg 1. And the International Criminal Court in The Hague should look, please, at Joseph Tritter's and my submission from June of 2022, and we're putting together supplementary submissions. The people have to be held responsible for their action, and these are bioweapons. And that's another story altogether. But please, let's get back to empathic people running the world, and not people who are making excess money just by reinvesting money and then claiming that they're doing it for the future of humanity because we're all threatened by the next pandemic.
That's what really gets on my nerves. That's what annoys me the most, is the hypocrisy of it. You've got people acting in their own interests, claiming that they're doing it for the good of humanity, and our role is to sit round and say, "Oh, thank you." Yes. It's just.
No, I mean, I argue that. I don't know if you look at the end of the book, but one or two people have commented to me that they like the idea that people, that there has to be a limit on how much money one person can earn. Maybe set it at $10 or $100 million, but not billions and billions. And not cashing in by just people reinvesting. Money has to be returned to its function, which is as a means of barter,
as opposed to a tool of control.
Yes,
a dictatorial rod of Dictatorship.
Unfortunately, as David Cartland has said, Dr. David Cartland, who's been struck off by the GMC for refusing to give these toxic vaccines to people, he quotes some doctors who are not getting vaccinated themselves but are vaccinating their patients. That is not part of the Hippocratic Oath. And people need to realize it's never too late to turn back. But it's really important now that there is an upwelling of protest against what is going on.
And on that note, thank you very much, David. It's been a great discussion, combined with the other ones, which we will put the link to. And we have persevered. We've persevered through a few technical difficulties, and of course we will put the link to download the David Anderson and David Grimes book, and I'll also put the link to that excellent interview I did with David Grimes as well, so people can